Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi friends, we are Brit and Andrea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Tabitha Uitenbroek, who's a board-certified family nurse practitioner and the owner of Löyly Family Practice based out of Appleton, Wisconsin. Since Tabitha was young, her mom recognized her as a natural caregiver, so it was no surprise when she became a certified nursing assistant in her teen years. After later finishing nursing school, she spent 13 years in hospital-based nursing, gaining experience in surgical care, orthopedics, and emergency care. Eventually, she felt too helpless within the corporate machine and wanted to be able to help patients on their own terms, so it became clear that pursuing additional training to become a nurse practitioner so she could start her own independent practice was next. Tabitha opened Löyly in 2022 and is now locally known as a patient-centered provider who beautifully balances traditional medicine with a holistic approach. She loves what she does and often says, "I'm here to stay because God has planted me squarely in this place." Tabitha is married to her husband, Andy, who's a freelance graphic designer, and she's a mom to 2 amazing boys, Oliver and Leaf. Tabitha and her husband creatively homeschool between both of their workloads, and as a family, they love to travel together. We recommend listening to this 4-part series in order, as many of the episodes reference prior episodes from the series. We had fun discussing some higher-level topics, like the importance of choosing a patient-focused healthcare provider in episode 1, and why self-pay is smart even when you have insurance in episode 2, along with some life application conversations, like how to take a preventative approach in your family's health journey in episode 3, and preventative medicine, which labs should you get and when, in episode 4. Okay, friends, get ready to learn a lot from Tabitha. I sure did. Let's dive into today's conversation. Hello. Welcome back, everybody. We are back with Tabitha. Hi, Tabitha.
Hello.
I'm really excited for this episode. We're going to be diving into some details of taking a preventative approach in your family's health journey. But before we do, I just want to point out that we had some awesome first and second episodes with Tabitha. The first one we talked about the importance of choosing a patient-focused healthcare provider, and the second one we talked about why self-pay is smart even when you have insurance. Those were really interesting episodes. Today we're going to dive into a little bit more of talking about prevention in your own home and your family's health journey. So, Tabitha, let's start out by defining taking a preventative approach. What do you mean by that?
Yeah. So prevention within healthcare can really mean 2 different things. Doing things with your lifestyle, supplements, overall health to stay healthy versus preventative. Sometimes in medicine, we mean it as let's catch something early. Colonoscopy screenings for polyps, mammography, for lumps, things of that nature. So preventative really does mean 2 different things. So it's good to clarify that, especially with your healthcare provider if you're asking for tests or having that conversation.
Okay. No, that is really helpful to start with, because when I think of preventative approach, I'm initially thinking, what can I do at home to stay healthy? So when I'm 90, I'm not just alive, but I'm like enjoying my life still.
Right.
But the other side of it too, of catching things early, is a really good point. And I think we'll dive into that one a little bit more in our 4th episode, because we're going to be talking about preventative medicine regarding labs and screenings and which ones you should get and when. So I think this episode is going to be a little bit more about the first definition of preventative approach and like how to stay healthy long term. So there are multiple categories here, and I feel like you can get really swept into the wave of trying to do all the things. So let's break them down into categories. And then I just want to hear your opinion on what you feel like is best or what your recommendations are. The first one being there are so many health benefiting practices right now. And this one is like the really big wave. They're all the rage. So there's like red light, grounding, cold showers, acupressure, sauna, journaling. Goodness. How do those all fit in to keeping maybe a simple preventative approach for your family's health journey?
Right. So I am a Western trained traditional nurse practitioner, but I prefer more holistic care when optional, when available. So I look at it from that lens. If you ask that same question of a trained naturopath or a seasoned integrative provider, you will get a very different answer. I tend to be more of a minimalist. So do I need it? Is it helping me? Is it absolutely necessary? Is it stressing me out? Because I'm thinking, I bought this red light, I bought this grounding blanket. I got to go get barefoot outside too. And sometimes that causes more stress than good. So really looking at from an individual basis. I'm struggling with a shoulder issue right now. I used the red light this morning on my shoulder. Glad I did. But I might not be faithful about using it every day unless I have an ailment or something I'm acutely treating. So I think I love that all of those therapeutics and options are coming available to people, but use them as you need to, not thinking you need everything to be able to be healthy and well.
How do you dictate for your own family which ones are important enough to pursue and put into your schedule versus not? Like, how do you do your own research?
I look at evidence-based. Here we go again with that buzzword. I do first look to see if there's any evidence behind it. So I want to see, have there been any controlled studies to say this is beneficial? What does the safety profile look like? Is there any risk to this new thing? And then ask around, what have people's experiences been? But other people aren't me. And so it's not necessarily, good for all. When the ice plunge thing came out, I thought, oh, that's interesting. That is pure torture. Absolutely not would I ever do that. And then I thought, but wait, if it's good for me, maybe I should think about it. And now I'm convinced it probably isn't good for me, for my hormone makeup in my stage of life. Probably I'm not a good candidate for an ice plunge, and which is relieving to me. But I try to go at it with a really open mind to see what does the science say. And then I look at it with my own health in mind. Is that something that is worthy, that would give me some benefit?
No, I think that's a really great approach. And what you just said is really important to remember is that we're all unique, right? And men and women are different, and there's different age groups that things are going to be appropriate for or not. So for the average listener, they're probably not going to go to PubMed and be reading articles on studies.
But you could.
I mean, you can,
You
for
can.
sure. You might need to, message Tabitha and say, interpret this for me. Kidding. But how do you think an average person can learn more about these? I think of podcasts are huge right now. And so you could find a podcast that says cold plunges are great. And you're going to find another podcast that says don't do them. They're alpha for you. So how does an average Joe really navigate through all these?
What will serve you best in your healthcare journey is to be self-aware. So to be in tune with your body of, man, I'll just give a silly example. Probably 2 months ago now, I just knew I needed some sauerkraut, and it was so bizarre. And I just knew I needed it. And there's a specific brand that my husband and I like because our veterinarian for our dog told us about it years ago. And I said, I think I really need some. And he's like, all right, that's weird. But he came home with it the next day. And that was so fun. And I did eat it every day for 2 weeks. And then I didn't need it anymore. I can't explain that. There's no science behind it. But it's the human experience. So when you're feeling those things, I think it's important to follow up and think, is this healthy for me? Okay, I should try that. And maybe I need some of it. And then when it comes to red light or ice plunge or all of those things, listen to both sides. Hear the pros and cons. If they're not covering any cons, then maybe look a little harder. Like you should be hearing, what's going to benefit you and what could be the downside for any medical intervention. And then just do a gut check of, does this seem like a good match for me? Is this worthy of a try? There's a lot of local sources where you can try things. So places that have a red light that you can just pay for a few sessions to give it a go and see if your headaches are better, see if your sleep is better, see if your skin feels better. Same with PEMF, pulsed electromagnetic field therapy. Same with sauna. All those things you can give it a try and see before you purchase it for your own house.
Yeah, trial and error. How long do you feel like for these different modalities would be fair for people to trial them before they kind of know if their body likes it or not?
hmm They're usually pretty quick, not for total healing. Like with my shoulder issue, it's been an ongoing thing. And the red light gives me major relief until maybe 10 hours later. But then you have to do added therapies and things for that. So it depends on the topic. If you struggle with acne, if you struggle with really sensitive skin, eczema, things like that, give the red light maybe 6 to 10 sessions and see if you notice a difference. Will you still need to use special moisturizer? Probably. Will you still need to address any gut imbalance? Probably. But you can see if it's ramping up your skin repair, just as one example.
Now, what about seeing other professionals like chiropractic, homeopath, etc.? What are ones that you'd recommend to see on a regular basis versus ones to just kind of like have on speed dial?
They're all valuable tools for the toolbox, as people would say. So I could make the argument that they all serve a great purpose. For constitutional care would be the homeopathy lingo. And for chiropractic, a lot of conversation for sure about the nervous system, overall health and wellness preventatively. But it's sometimes financially a burden to do all the things all the time, same as buying all of the equipment. So, unique individual decision about, is this a stressful time in our lives? Maybe we should ramp up some of these support tools. Or maybe you just do have more acute needs and then you reach out for those resources at that time. So, individual family question.
And then I think one that is really common this time of year, it was especially as the school year is starting back up, is what you can do at home for health prevention. And now, I might be talking more like colds and flus in short term. So we're not looking like, oh, I want to be healthy when I'm 90 necessarily with this piece. But what type of like supplements or vitamins do you feel like are appropriate for people to be taking on an ongoing basis to support a healthy brain, body, and immune system?
Well, surprisingly, not surprisingly, but kind of, in nursing school, I learned that vitamins were a total waste of money. There was no value in them. It was just all a scam. So that did kind of frame my thinking for the early years. And then when I started working in the hospital, we were giving lactobacillus probiotics to all of our post-surgical patients. And I thought, that's weird. I thought those were a waste of time. Why are we doing that? And occasionally multivitamins. And then vitamin D really hit. It was a huge boom. It's a hormone. I'm so annoyed with whoever named it vitamin D. It's very misleading for the community. But that became this huge boom of recognizing we need to check these labs as part of our immune health. And so then slowly I started reading into, do I need to take a multivitamin? Do my kids? Like, what should I do? So again, that's very individual based. I do not tell every family, you all need a multi, you all need D, you all need magnesium. But for specific things like, oh boy, school just started, I want to boost our immune system, I do think a little bit of zinc is a great idea. I do think, adding some C into your life or a good kids multivitamin makes good sense for a season. But more so, it's about sleep. Is the sleep quality good? Are you well hydrated? What does that mean? Are you adding essential minerals to your water? Is your stress level managed? Are you getting outside, getting some sunshine, getting some movement? I do think that is still more value added than taking a supplement in most situations.
And I would imagine in today's age, multivitamins have come a long way from where they maybe used to be. There are so many very reputable companies now that offer multivitamins, and our nutrition has changed. Our food has changed. So kids might, and I mean adults too, may not be getting, even if they're eating a healthy diet, they may not be getting everything that they need. Do you agree with that?
I do. And I look for specific supplements that are very honest about what's in them and that they say that they're independently verified to really have the quality and the contents that they claim to have on the bottle.
What about elderberry?
There is science behind it. I have made my own elderberry syrup with organic freeze-dried elderberries and local honey. I don't love it. I don't love the taste, of making my own. I think any immune boosting agent can serve a purpose for a time. But for any families that struggle with autoimmune disease in their family, they should be cautious with heavily dosing immune boosting supplements. So, time and a place. That's pretty much my answer for everything.
Can you explain what you just said a little bit more?
If you have an autoimmune disorder, if your body is fighting itself, and then you ramp up your immune system, you could exacerbate that condition.
Okay.
Unintentionally.
Sure. Yeah, that makes sense. So obviously that's where they should be working with their healthcare provider on that. Hmm. So when it comes to a preventative approach, I also think about what you offer. And should kids and adults, maybe let's talk kids first, should you be bringing in your child annually and why? Because, oftentimes you maybe go to your child's wellness visit, which we talked a little bit about those last time. You get the basics, height, weight, and it's kind of like, does the government just want stats on my child? Like, why am I doing this? I don't know what really came of this. Is it worth it to go? What is your feel on wellness visits for kids on a yearly basis?
So we're going to take vaccines out of the equation. So forget about that. And let's just talk about, from do you need to see your physician or your NP annually? Because the vaccine thing will just make it more complicated. So my medical hat says yes. And my mom hat says yes, because medically you could pick up a new murmur. You could identify a new blood flow issue. You could identify a cardiac concern based on the way the kiddo answers questions about how did you feel when you ran soccer this spring. So there is value medically when the provider is asking those good questions and doing that basic assessment. Growth chart, it's so unique per person, depending on family, stature, and all of that. So there's value in looking at the trend of a growth chart, but you can do that at home. You can do that at the chiropractor's office. So yes, medically, you could pick something up for sure with an annual visit. So I do think there's value. As a mom, I like my boys to be comfortable with their family doc. I like it when patients come to my clinic regularly so that the kids are comfortable with me, because at one of the visits, it's going to be uncomfortable. Someone might need a lab draw, someone might need stitches, a glued forehead, and I don't want them to be scared meeting me for the first time in a uncomfortable way. So there's value in that relationship.
Sure. No, that's a really good answer. What about adults?
Same. They're not usually as scared as a kid might be, but things change in our health. Patients might not realize it's a problem. It shouldn't be normal that you're a 45-year-old female who just suddenly stopped sleeping at night. That shouldn't just be something you expect in the perimenopause season. And you might not realize that you shouldn't accept that until we talk about it. Same as many other bodily changes. So just making sure that you're doing well. It's a comprehensive conversation. It's an opportunity to ask questions and just make sure that you're staying on top of things.
What should an annual visit look like for an adult? What should they expect if they haven't been to one in a long time?
Mm-hmm. Like I said earlier, a slew of questions. So quite a bit of head to toe questions about how you're functioning and how you're doing. I generally say, do you feel healthy and well? And then do you have any complaints? And then start with my questions. The physical exam is not in-depth and detailed, blood pressure, heart and lungs, ears, throat, pushing on the belly, checking pulses, asking about skin, looking at skin. Those kind of things are generally what I try to cover.
And we're going to talk about labs specifically in the next episode, but just to touch on it here, are labs part of a typical annual exam, or is that not?
For a child, if they have specific complaints, I may recommend labs, like screening for anemia, for example, or vitamin D. For an adult older than 35, there are some routine labs that I do recommend that we check.
Okay. We'll dive more into that into the next episode, so you guys got to stay tuned for that. But for you and your practice, how do you balance having a holistic and preventative approach with being medically trained? Is that hard for you at all? Because it can be two different worlds, but I don't know that it needs to be. So what's your approach for care?
I don't find it hard. I do refer to it as a tightrope often. I should probably come up with a different analogy, but I look at people as medical marvels. It's amazing how our bodies function. And I know what normal is. I know what abnormal is. And I also have 20 years of nursing intuition now when just something is not right here. And I can't quite put a name on it yet, but we need to look. I do have that. So when I'm meeting with a patient and I find an abnormal, I'll say, hey, this is what I identified. This is what I'm thinking. This is, what in medicine we would call a differential. It's either this, or it could be this, but we need to test some more. And then I'll say, do you want to talk about it from a medical standpoint, or do you want to talk about it more naturally?
Okay, awesome. What is your best advice for when it comes time to make a healthcare decision? Because obviously for prevention, you're hopefully going to your annual visit, you're going to be asking these questions, but then things can come up. And so whether it is getting a new lab done or something that maybe just seems a little bit off, what is your best advice when it comes time to make a healthcare decision?
I trust people's intuition. So for some, they may have a faith base, and that's asking God for direction. For others, it's more of a gut check. I trust that. So if you've been given the options, I think transparency with what the physician or NP is thinking is imperative to that decision. So if you know I'm thinking, this is a gallbladder issue, we need to rule out stones, we need to rule out, dysfunction, just as one example. And then I give options. Do you want an ultrasound? Do you want to try this supplement? Do you want to go see a general surgeon? So laying out those options, and then the patient's intuition for their kid or for themselves, once you've been given those choices, I think is the best way to make that decision, which doesn't sound very scientific. But back to the earlier point of be in tune with your body, you can normally make a really great decision that way.
Well, and I love what you're saying here of, again, going back to your patient-centered approach of like, okay, here's what we're experiencing. Here are 3 different options that you have. Here's the pros and cons of each one. Like, this points to exactly why you need at least 30 minutes with each patient, because there's going to be questions, right? And you need to be able to explain each one in depth and then help lead them to the decision that feels best for them. Yeah. Yeah. So just to take a step back here, going back to the title of this episode, how to take a preventative approach in your family's health journey, what would you say, if you took a step back, should be like the main priorities for people to, if we're talking long-term health, setting yourself up for success long-term so you can live a long, healthy life, what are things that people should be doing?
Oh, so I go back to Maslow's hierarchy of needs, which is old school. I learned it probably first year of college. I'm looking at it right now, actually. Physiological needs, safety needs, belongingness, esteem, and then self-actualization. So focusing on water, breathing, movement, nutrition, sleep, really that is the basics of preventative care. Everything else is based on your unique needs. So I need personally mental downtime. It is essential for my physical health, my mental health, emotional. And that physical downtime for me includes a grounding sheet and red light therapy in the morning. So that's what I need. I don't take a lot of supplements. I do take a few things, but I don't take a lot. And then I take more when I need to if I've been exposed to something or I'm, feeling really run down. So preventative healthcare should be your own personal formula of what you know that helps you be the most fueled.
What do you do for your boys for preventative care?
They do not take a daily supplement. They are forced to drink more water than they want to drink. They're forced to get outside in the fresh air. They do use a grounding blanket kind of as needed, and they do have access to the red light as needed. I have one that uses it for sleep periodically in particular. And we focus on the basics for them with sleep for sure and movement, especially my youngest. Mm-hmm.
Mm-hmm. No, I love that. Thank you for sharing what your family does, because I feel like that's that's something that so oftentimes listeners are wondering is there's all these options, right? How do you weed through all these options when one person says do this, one person says don't do that? And so, but also understanding what you do for yourself and your family. And it'll be different for everyone, like you said, but I do appreciate you sharing what's worked for you. This was a great episode. We're going to jump into continuing talking about preventative medicine in the next episode, talking specifically about the world of labs. So stay tuned for that one. And thank you, Tabitha, for joining us today.
Thanks.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.